Michael's case is quite different from others in terms of rehab, because it's first of all the surgery is quite advanced in that case. First of all, the patient cannot load the joint itself for about 4 to 6 weeks, and it's challenge for rehab, because usually we are used to make the rehab as fast as we can, and in this case we should be a little bit slower, that we have to have some protection for the bone itself, because it should heal properly. But on the other hand, the other muscles around the joint should be working, and this is the challenge in rehab, to make it easier and to have that rehab in most effective way as we can do it. So we are using the electrical muscle stimulation to recover the muscle. Also, we are using different type of unloaded exercises which are helping to restore range of motion, muscle strength in general, and of course give some confidence for the patient that the knee itself will be good, and it will help him to recover to the previous level of physical activity, and the patient would be able to be ready to move anytime when the surgeon will make a decision that the bone is already healed. So this is very important all the time, to keep the patient and to keep the patient's motivation to work hard in order to prepare himself to the time when he will be on his feet again, walking normally, and live his own life in the way he wants to do it. So it's very important to start the rehab immediately after surgery. So as we did, day 2 after the surgery is the time when we have started the rehab. It was not so much to do at that time in terms of active movements, but we placed the patient's leg in a special machine which is moving the leg not to get stiff. Also giving some active exercises to do in the hotel. So every patient which is staying here for the rehab with us is having the special program which should be done at home when we are finishing the outpatient rehab. There are some tasks which keeping the patient physically active and working on his problem also in the room, and just not lying and watching to the ceiling, but doing something which will help him to recover faster. So our idea is just to control the whole process, means that control the swelling, check the wound, change the dressing if there is a need. So we want to take care about the patient in all the situation which might be happen. So we are happy that with the Michael's case, everything is going smooth. The recovery is quite fast, and we are pleased how he's progressing at the moment.